Let's talk about the death of bodybuilders. There was a bodybuilder that died kind of recently, right?
Yeah, that was a shocking one too. He was 30 years old, one of the biggest social media influencers too. And
what was his name?
Joe Lindner. With him, the scariest part was he was one of the guys who was doing all the right things, at least from a blood work standpoint. So he would get blood work done literally every 2 months, if not more frequent, and was very, very rigorous about trying to oversee his health status, and his blood work wasn't perfect always, but it certainly wasn't somebody who should be dying at 30 years old, regardless of, back in the day, or not that long ago even, it would be unheard of for somebody to be dying if he wasn't a massive bodybuilder by industry standards for fitness, where we have this warped perception of what is big versus not. He was like 50 pounds off of what you would consider a top level open class bodybuilder who would compete with Ronnie Coleman or something. So he was more of like a jacked fitness model by fitness industry standards, and less drug use, significantly less drug use, less food intake. He was always in a calorie deficit, shredded year round. The guy did lots of cardio, at least like 10,000 plus steps a day, ate clean. Like, there was no reason objectively, at least, why he should die at 30. Like, you might expect that his lifespan would.
And what are the known circumstances of his death?
So apparently and this is the thing that's, I don't even know if you're gonna want this in the podcast, dude, but he got apparently the vaccine and 2 boosters on top of it, I believe. Might have even been more. But after he got it done, apparently he got his blood work done just routinely, and they saw supposedly that the blood they pulled out was like really coagulated and weird looking. And I forget exactly his terminology, but he literally did a podcast maybe a week or 2 before his death, how he got a blood test done, and they were telling him that he needs to get a plasmapheresis to clean his blood because it was so messed up from the vax. So he did it twice apparently, and then supposedly his D-dimer went back down because it was super elevated in his blood work, and they said he was fine now, and he cleaned his blood and reintroduced it back into circulation. He would be good. He made a long trip to the US. I actually met him for the first time like a couple of weeks before his death. And then when he flew back to Thailand, which is a really long flight, and there's some clotting risk associated with that, on top of all the other things, which is speculated to be something that's another variable. But he got back seemingly fine, and then apparently a few days after he got back, he was complaining of neck pain. His aunt supposedly died from aneurysm in her neck. That is what we have been told. We have yet to see autopsy report on his situation, but his girlfriend at least reported that his aunt died from the same thing and had a aneurysm in her neck. Whether
in her neck or in her head?
It was apparently neck specifically, which I would think is kind of unusual.
Yeah, I won't even speculate without an autopsy, I think, but again, tragic, obviously, but hopefully an autopsy sheds light on that. I mean, it's not difficult to know if someone dies of an aneurysm on autopsy.
Would you scope that out with like a Pernuvo scan before you even, like, hypothetically, if somebody...
Yeah, that's actually one of the reasons we really do like whole body MRI. The incidence of aneurysms you'll see on a whole body MRI is about, depending on the series, somewhere between 1 and 7 cases per 1,000. Now, not all of those are aneurysms that pose risk, meaning they're not all aneurysms that, if left alone, would ultimately rupture. A number of those require intervention. So we've probably, in the last 7 years, had 2 patients, and if you think about how small our practice is, 2 patients who have had incidental captures of intracerebral aneurysms that were both large enough, in one case large enough, in another case growing quickly enough to a large enough size that they needed to be coiled preventatively. So, but again, the aneurysms that typically kill people are, in the head, behind the stomach. Those are the ones that you kind of want to look out for. Also, as far as if he had a deep vein thrombosis, which would certainly be a risk factor on a long flight, that could obviously kill you with a pulmonary embolism. Again, very easy to diagnose on autopsy.